Hey all, this is Eric Christensen, pharmacist, back with you today on the Real Life Pharmacology podcast. Thank you to all of you who have certainly followed the podcast, and hopefully you're listening and learning and picking up a few pearls. If you like the podcast, like what you hear today, would love a kind rating and review on iTunes if you have the time, or wherever you're listening. Those have been greatly appreciated to those of you who have done that. But with that note, let's get into it. Today I've got Depakote, which is the brand name, or valproic acid, or valproate, it's sometimes called as the generic name there. And this medication has quite a few potential uses. It's one of those kind of jack of all trades type medications, but also has a lot of potential downsides, adverse effects, and those type of things too. Being one of those drugs with kind of multiple effects, you can anticipate that it's probably got a few different mechanism of action. And the two major ones I'm going to talk about is it's got an effect as far as increasing the availability, the effect of GABA, which, if you remember in physiology, GABA is an inhibitory neurotransmitter. So that's one effect, kind of increasing that activity, availability. The other effect is its potential to block sodium channels, specifically voltage-gated sodium channels in the central nervous system. So they're by stopping the action potentials and different pathways through that aspect there. So that kind of leads into some of the potential uses. And classically, Depakote, or valproic acid, is classified as an anti-seizure medication. But it is definitely used in migraine prevention and also bipolar disorder. There's a few other oddball uses that you may see it for from time to time, but those are really the big three that I see it used in clinical practice. So seizures, migraines, and bipolar disorder. Now, getting into some of those effects, let's talk about the adverse effect profile, because there are definitely some very notable adverse effects. For more of a generalized, short-term type effect, I think of CNS changes. And you can kind of think of this with any drug that works on the brain. So sedation, confusion, dizziness, definitely things that can happen with valproic acid. Now, I do want to speak specifically about confusion and those type of symptoms. So valproic acid is very, very unique in that it can raise ammonia levels. And ammonia is a toxic substance within the body. And the other patient population, other than patients on valproic acid, classically where you're going to see elevated ammonia levels is in patient with cirrhosis and hepatic encephalopathy. So that's where you're going to see elevations in ammonia. But Depakote, valproic acid, can also cause this. So if you see a patient displaying those symptoms, checking an ammonia level might be an appropriate thing to do in somebody taking valproic acid. Other things I've seen in clinical practice come up, hair loss, so that's kind of a unique one, something to think about if you're having a patient with that kind of trouble. Typically that's more troublesome for females than males, but something to think about there. GI side effects can happen, stomach upset, that type of thing. I have seen some significant weight gain from this medication, so that's something to keep tabs on as well. Weight loss has also been reported as well, so kind of maybe can go either way there, but just remember that GI side effects can potentially happen. Dosage forms, I did want to make a note of that. I'm not going to get into great detail on that, but just remember that they're not perfectly interchangeable. Now, in a patient maybe where we're treating migraines or something like that, maybe differences in bioavailability and concentrations isn't a huge deal. But if you get into managing seizures and something sensitive like that, where target concentrations can really matter, and the closeness between toxicity and or seizures, it's called a narrow therapeutic index. That closeness can be very, very sensitive potentially to those changes. So if you're ever changing a patient from a different dosage form to another dosage form of valproic acid, you've got to look it up and look at that bioavailability. So I wanted to make that note. Couple other things as far as notable adverse effects and warnings. Specifically, there are a couple of boxed warnings that I really want you to know about. Liver toxicity can happen with valproic acid, so definitely remember that one. I've seen that one tested quite a bit on various exams throughout my career. Congenital malformations, so pregnancy. This drug should not be used in pregnancy. Now, that can get a little bit dicey because many females, younger females, have trouble with migraines, and this is why we probably steer clear of using this drug in that younger female patient population. But if you see a younger female patient on that, obviously you're going to probably make sure that we're preventing pregnancy through birth control and whatever method we're using there. But very, very important, because Depakote can and has been shown to cause some effects to the baby there. One other side effect that I actually have seen in clinical practice, pretty rare, but thrombocytopenia. So valproic acid can drop those platelets. So that might be something to look out for in patients who have thrombocytopenia and or displaying symptoms, bruising, bleeding, things of that nature. One other pharmacokinetic property, I kind of talked about dosage forms and how they matter a little bit, but I did want to mention protein binding. So in our blood, we've got albumin, and drugs bind to this albumin at varying extents. Valproic acid is one of those that binds to albumin very, very tightly. So what this means is if you've got a patient that's malnourished, maybe a very elderly, frail patient, their albumin levels may be low, which means there's a higher free fraction of drug. End result being this patient that has low albumin may be at higher risk for having a greater free fraction, which ultimately leads to a higher risk of toxicity potentially. So something to keep an eye out for there. Monitoring, CBC, I mentioned those platelets, LFTs. We've got that warning on hepatotoxicity. If a patient is displaying symptoms of, confusion, delirium, things of that nature, ammonia level is going to be important. And we do check drug levels potentially with valproic acid as well. So in signs of toxicity, where we've maybe got some CNS things going on, in signs of having seizures, let's say, we're going to probably check those levels as well, see where that patient's at, and should we escalate the dose and those type of things. So just for reference, you'll see out there target levels kind of ranging between 50 to 100 or 50 to 125 micrograms per mil. So that's usually kind of the target range if we're using the drug to target specific levels. Like I said, in the case of seizures and or potentially bipolar disorder is another one where we might try to hit certain target concentrations. Obviously based upon patient response, based upon the potential for seeing those signs and symptoms of toxicity. Let's take a quick break from our sponsor, and then we'll wrap up on drug interactions. If you love the podcast, go support meded101.com/store, STORE. We've got wonderful books on clinical pharmacology, patient cases regarding medication therapy, really cool resources for any healthcare professional who works with patients and medications. You can really learn a lot from some of the stories and case scenarios we've put together in Pharmacotherapy and The Thrill of the Case, two books that I and a couple other pharmacists have created and edited. So really unique resources there. Also, if you're looking for NAPLEX, BCPS, BCACP, BCGP board certification study material, we've got that as well. So definitely go check out those resources, support the podcast. That's always greatly appreciated. So wrapping up on drug interactions, I definitely wanted to make you aware of absorption issues. And one of those classic medications, which isn't used a lot, but can definitely bind up drugs, is Questran or cholestyramine. So I should do a podcast on that coming up here, because it can definitely alter concentrations of valproic acid and potentially block absorption when you give those drugs together. So if you ever see a patient on Questran, cholestyramine, you've got to look at drug interactions. You've got to look at timing. Typically, we want to do at least probably 2 to 3 hours separation between cholestyramine and giving another drug, especially ones that are sensitive and have a tight, drug concentration window that we're trying to hit. So that's a good drug interaction to remember. One I have absolutely seen in clinical practice is lamotrigine. So with Depakote being on board and starting lamotrigine, or you're on lamotrigine and you start Depakote, drug concentrations of that lamotrigine can potentially go up substantially. And this can lead to usually the major side effect with lamotrigine, or the major concern, is skin reactions, severe life-threatening Stevens-Johnson syndrome. So that's a good one to remember. Carbapenems, used in hospital-type setting most often there. These drugs can actually reduce valproic acid concentrations, so that may lend towards a patient having a seizure, maybe exacerbating their bipolar disorder if they're maintained by valproic acid, but a good one to remember there. So carbapenems can reduce those valproic acid concentrations. And then I always think of other CNS depressants, sedating medications, benzodiazepines, drugs used for sleep, opioids, things of that nature. Valproic acid being generally more sedating, can obviously pile on top of those effects with some of those other drugs that may cause those effects too. And then liver toxic agents. So, if you've got a patient at risk for liver toxicity, maybe they're on statins, which, again, statins don't cause liver toxicity very often. But if you think about, maybe an accumulation of different drugs, maybe they're on phenytoin, valproic acid, acetaminophen, statins, all these drugs together, there may be a little bit, greater risk of causing some liver trouble, liver toxicity there. So definitely something to think about. One more I did want to mention was amiodarone. Definitely well known to cause some potential liver issues. So if you've got a patient on that and valproic acid, we've kind of got to be ultra concerned about monitoring that liver function for sure. So I think that's going to wrap it up for today. Valproic acid, very complicated, complex medication that can have a lot of different effects. And hopefully I summarized some of those effects for you today pretty well. If you like the podcast, leave us a rating, review on iTunes, wherever you're listening. That's greatly appreciated. I've got that giveaway at reallifepharmacology.com. It's a 31-page PDF, the top 200 drugs. Great resource for young pharmacists, students who are taking board exams, MCAT, and so on and so forth. I've had lots of different professions reach out, from NPs to PAs to med students who are learning pharmacology, and definitely found that resource helpful. So go check that out at reallifepharmacology.com. We'll send you an email too when we put up a new podcast, or if we've got anything else going on there. So I'll sign off for today. Thanks so much for listening. Hope you have a great rest of your day.